Throughout the course of this last week, we learned that Trumpcare imploded when it failed to muster enough support among Republicans and Democrats in the Senate. Now, Donald Trump afterwards held a press briefing with Senate Republicans to talk about why they should get on board with his draconian healthcare bill. Now, he stated that since insurance premiums are rising under the Affordable Care Act currently, Republicans and Democrats should feel compelled to act. Now, in weighing out the different options and trying to throw both Republicans and Democrats under the bus, he talked about single payer. Now, what he said about single payer was a lot different than what he said previously about single payer throughout the course of his career. So, let's hear him out. Let's hear what he has to say. And then I have quite a bit to say about the way he described single payer.
We have no Democrat help. They're obstructionists. That's all they're good at, is obstruction. They have no ideas. They've gone so far left. They're looking for single payer. That's what they want. But single payer will bankrupt our country because it's more than we take in for just health care. So single payer is never going to work. But that's what they'd like to do. They have no idea what the consequence will be, and it will be horrible, horrible health care where you wait online for weeks to even see a doctor.
Okay, so you get the point. The Democratic Party, they've moved so far to the left, and that's why they won't support his healthcare bill. It's because they want single payer instead, which is strange to me because when they had a supermajority, they opted to go for a Republican healthcare plan, the Affordable Care Act, instead of single payer. And furthermore, they don't support single payer. He's giving the Democratic Party credit for something that they're not in favor of. If they did support single payer, they would be exponentially more popular because a majority of voters, including a plurality of Republicans, now support single payer. So by saying, one, that they support single payer when that's not true, and saying that they are extremist for supporting single payer, is simply untrue. It's just a populist position to take. And of course, we all know the Democratic Party does not support single payer. We are doing everything in our power currently to push them towards single payer, but a lot of them are not willing to budge. Now, also, a lot of what he said about single payer, irrespective of what he said about the Democratic Party's support for single payer, it was just flat out wrong. So let's get to some of these specific statements that he said about single payer, because it really was obnoxious given what he said about it previously. So first of all, he said that the Democrats have no ideas. That was possibly the one thing that he said throughout the course of this press briefing that was actually truthful, because they don't have any ideas. And of course, single payer certainly is not one of them. There's some Democrats who are coming around to the idea of single payer, but the aggregate party still does not support single payer. Democratic Party leaders like Nancy Pelosi, Chuck Schumer, Tom Perez, they don't support single payer. So to say that they support single payer is wrong, but Donald Trump is correct when he states that they have no ideas, because they don't have any ideas. Now, he also states here that single payer will bankrupt our country. This is just flat out wrong, because we pay more per capita than other countries with single payer and we get worse results. So that's a lie. It's not grounded in reality, and the data just doesn't back up this assumption. He is using a health insurance industry talking point. Now, he also states here, which is my favorite part, single payer will be horrible, horrible healthcare where you wait online for weeks. Is that so? Is that so? You're going to wait online for weeks. I don't know what waiting online for weeks means, but basically he's using the same tired talking point that Republicans as well as some corporate Democrats and the health insurance industry uses. It is a way to scare people into making them think that the government will determine how long you're going to have to wait, when in actuality, single payer works out just fine in countries like the UK and Canada. But I'm not going to debunk Donald Trump's argument here with my own argument. I'm actually going to use Donald Trump's previous arguments against him. So in a 2015 appearance on The Late Show, he stated, "A friend of mine was in Scotland recently. He got very, very sick. They took him by ambulance and he was there for 4 days. He was really in trouble and they released him and he said, 'Where do I pay?' And they said there's no charge. Not only that, he said it was like great doctors, great care. I mean, we could have a great system in this country." So to me, that doesn't really sound like a, quote, horrible, horrible system now, does it? Now, Donald Trump, in saying this, it's not like Scotland was the outlier, like he was against single payer, but Scotland was the one exception because he stated how much he liked Canada's system as well. In a book he published in 2000 titled The America We Deserve, he wrote, "The Canadian plan also helps Canadians live longer and healthier than Americans. There are fewer medical lawsuits, less loss of labor to sickness, and lower costs to companies paying for the medical care of their employees. If the program were in place in Massachusetts in 1999, it would have reduced administrative costs by $2.5 million. We need, as a nation, to re-examine the single-payer plan, as many individual states are doing." Does that sound like a horrible, horrible plan to you? Because to me, that sounds great. Now let's go back and read that quote again. "If the program were in place in Massachusetts in 1999, it would have reduced administrative costs by $2.5 million. Now, let me remind you again what he said about single-payer healthcare this week.
But single-payer will bankrupt our country, because it's more than we take in for just health care. Wrong.
Now, let's be clear here. It's not like he admired certain aspects of single-payer healthcare and overall was more in support of a market-driven, for-profit model. He outright supported single-payer healthcare at one point in time.
A liberal in healthcare. We have to take care of people that are sick.
Universal health coverage.
I like
for the nation.
universal. I like universal. I like universal.
Donald Trump supporters will counter by saying, look, Mike, that was 17 years ago. Is he not able to change his mind on this subject? Well, sure, he is able to change his mind like everyone else, even though he shouldn't, because the Donald Trump in 2000 was more correct than the Donald Trump of 2017. But even when he was running for president back in 2015, the sentiments that he expressed towards single payer were generally supportive of it.
15 years ago, you called yourself a liberal on health care. You were for a single payer system, a Canadian-style system. Why were you for that then, and why aren't you for it now?
As far as a single payer, it works in Canada. It works incredibly well in Scotland. It could have worked in a different age, which is the age you're talking about here. What I'd like to see is a private system without the artificial lines around every state. I have a big company with thousands and thousands of employees, and if I'm negotiating in New York or in New Jersey or in California, I have like one bidder. Nobody can bid. You know why? Because the insurance companies are making a fortune because they have control of the politicians, of course, with the exception of the politicians on the stage. But they have total control of the politicians. They're making a fortune. Get rid of the artificial lines, and you will have yourself great plans. And then we have to take care of the people that can't take care of themselves, and I will do that through a different system.
So notice that for most of that video, it seemed like he liked the idea of single payer, but ultimately was more in favor of a market-driven model. However, towards the end of that clip there, he talked about how overall he's going to take care of people that are not able to get insurance themselves. So he's kind of flirting with the idea of single payer, even though he's not outright endorsing it like he did back in 2000, but nonetheless, he still is expressing support towards the idea of single payer. But now he's saying that single payer would be a horrible, horrible plan.
And it will be horrible, horrible healthcare.
And less than a year ago, when he was first elected, he signaled support for single payer yet again.
Everybody's got to be covered. This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now.
The uninsured person is going to be taken care of.
They're going to be taken care of.
How?
I would make a deal with existing hospitals to take care of people. And you know what? This is probably...
Make a deal. Who pays for it?
The government's going to pay for it, but we're going to save so much money on the other side. But for the most part, it's going to be a private plan, and people are going to be able to go out and negotiate great plans with lots of different competition, with lots of competitors, with great companies, and they can have their doctors, they can have their plans, they can have everything.
So what he said there sounded a lot like a single-payer system, or at least a watered-down version of single-payer. So my question is, how did we get from this,
everybody's got to be covered,
to this,
single payer is never going to work,
in the span of 1 year? Well, I could give you 4.7 million different reasons why Donald Trump changed his opinion when it comes to single payer. Because when you look at his contributions from the health industry, he took $4.7 million from them. And if he chooses to make single payer a reality, then he loses out on all of their money come 2020 when he's going to be running for president again. So it's very clear Donald Trump was bought off. Even though during his campaign he lambasted other Republicans who were puppets for their donors, now he is just as big of a puppet as they are, if not worse, because if anything, he's become more corporatist than the establishment Republicans he lambasted during his campaign. So Donald Trump is now against single payer. He's an enemy of single payer when he knows deep down inside that single payer is the way to go. I don't believe that Donald Trump changed his opinion. Well, I mean, let me be clear. It's certainly possible that he changed his opinion because he's flip-flopped on 1,000 different issues multiple times. But when it comes to single payer, I think that the reason why he's against it now is easy. It's because he was bought off by the health insurance industry. It's that simple. And he was co-opted by the establishment. And now he knows that that's a very unpopular thing to say if you want to seek the support from the establishment. And I'll tell you this, Donald Trump, a majority of the country, including a plurality of people in your party, want single payer. And by saying what you're saying, you're not saying anything unique or brave. You're saying what all the other sellouts say about single payer. And it's not true. So bring back the old Donald Trump, who was right when it comes to single payer, because even though you were wrong on a plethora of other issues throughout the course of your career, this was the one area where the broken clock that is Donald Trump was right twice a day. You're wrong now. Single payer is the way to go if you ever actually want to stop medical bankruptcies and deaths from people who don't have health insurance.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.